There is a very big challenge now in our country because most of our patients, most of our clients, they started losing faith in our services we are offering as a nation. And that's why you can see most of our patients, they are now trying to get treatment in abroad. So as a nation, we have a very big challenge to try to build faith in our citizens so that they started trusting the kind of services we are offering.
More than half of the Tanzanian population, especially the rural, are accessing care through the private health sector. So the private health sector has a significant role in provision of services, and the Ministry of Health or the public on its own cannot meet the demand of the citizens. So the private sector is there to complement the government's efforts towards provision of these services. And for the private health sector to complement effectively, they need to also complement with quality of care being provided at these facilities.
The main issue which here we are dealing with is to make sure that we improve the quality of services in our country. Tanzania has close to 7,000 facilities, but almost 80% of those are the primary health facilities. When we say the primary health facility, we started from the district level to the dispensary levels.
We saw that in order to improve, we have to increase the number of rooms. We have to divide the departments. We have to train our staff. We have to try to implement the use of system.
Before we embarked on this journey of SafeCare approach, most of our procedures were not guided by principles, policies, and guidelines. Today, as we speak, thanks to implementing of this SafeCare approach, thanks to the supervision of the quality improvement team, which is now active and revitalized, all our procedures are guided by principles, policies, and the guidelines.
If we look to the facilities which now we are working with the PharmAccess through the SafeCare standard, we have seen a lot of improvements, specifically on the issues of the provision of service, human resource, diagnostic. Now we can see a lot of facilities, when you go there, the issue of quality is number one. We government also own some of the facilities, and we are not the best organization to be accrediting facilities. So we are expecting to have an independent body which is going to do these regulations and accredit facilities so that we remain with the policy issues and make sure that the provision of services according to the required standard.
Upgrading programs with the improvement is expensive. It's expensive for the meaning that you will need to improve the infrastructure, you will need to buy equipment. And in most of these facilities, especially the small facilities like the dispensaries, maybe the health center, they have limited resources, especially financial resource. So through the soft loan from the Medical Credit Fund, it enables us to improve our infrastructure. It enables us to buy the equipment so that we satisfy the needs of our patients.
We also understand that in Tanzania, the private health sector is not financed very well. Most of them are not accessing loans through the banks. So MCF is playing an important role to provide this financing to these facilities that need finance for them to improve the quality of care. If the quality of care is good, there will be more clients that build the confidence of coming to that particular facility.
We have evidence of increased income of a facility thanks to increased client satisfaction as a result of this SafeCare approach. Let me give you some few statistics. A year ago, before we embarked on this journey, revenue from Community Health Fund per month was around 200 shillings Tanzanians. Today, as we speak, per month is more than 800 Tanzanian shillings. This is an increase of almost 400%. It is true that to implement SafeCare, to improve quality, we chip in some funds. But as a result, client satisfaction goes high and the revenue goes high. So I would say that SafeCare initiative is feasible. Is feasible in Tanzania, is feasible even at lower facilities despite resource constraints.
My dream is to see that Tanzanians get quality, healthy services, either through the private or through the government. Because I believe in order to develop, we need people who have education and they are healthy.